Well, a state-formed advisory group has ruled Vermont is not yet ready to start a program exploring the medical uses of psychedelics. The group issued its final report earlier this month, concluding more research still needs to be done. ABC 22's Jordan Barber gives us more insight into their findings. She's here with us now live in the newsroom. Jordan.
Matt, lawmakers formed an advisory group earlier this year to explore whether healthcare providers should be allowed to use psychedelics to improve mental health. This comes after 2 states, Oregon and Colorado, enacted a process of legalizing psychedelic substances, while a third, Massachusetts, recently rejected a statewide initiative. Over the summer, the state tasked the Psychedelic Therapy Advisory Working Group to review current research, consult with experts, and explore state programs on psychedelic-assisted therapies. A final report concluded that Vermont wasn't there yet. Despite this, the report also requested lawmakers let the group continue to do its work and expand its study.
The substances are not new. They have been around for ages. Research around them is what is newer, and the use of them in our society, specifically in medicine.
Group member Kelly Klein, who also serves as a medical director for the Department of Mental Health, says the outcome was to be expected as the 9-member group struggled to come to a consensus. Dr. Klein tells me she hopes the group, if continued by lawmakers, will keep researching and monitoring new data from other state programs before potentially developing its own unique model.
But we can watch and learn from their programs and see what they're doing to make sure that the population remains safe and to make sure that things remain therapeutic for people.
Well, there was some agreement in the group around focusing any statewide programs on psilocybin-containing mushrooms, also known as magic mushrooms. Some members ran into disagreements over FDA approvals and safety. Dr. Rick Barnett, a group member, licensed psychologist, and co-founder of the Psychedelic Society of Vermont, says he thinks there is enough positive evidence to start a program without FDA approval. He also believes the group should focus more on decriminalization in addition to medicinal use.
If people are growing their own mushrooms and they're using it in a safe way, can we provide more public education and training around how to use these substances safely and let people make their own choices around these things?
Now, members will wait on lawmakers to see if their work can continue and if there is a path forward for psychedelics in the state. In the meantime, the group has advised the state to develop harm reduction training for providers who may come across those using the psychoactive substances as it grows in popularity. Reporting live in the newsroom, Jordan Barber, ABC 22 News.